Hi Devin, my name's Tara and we're going to be doing a head-to-toe physical assessment today. How are you feeling?
Good.
Good. Do you need to use the restroom or take a break before we begin?
No, I'm fine.
Okay. I closed the door. We're in a private room, so you don't have to worry about anyone seeing you undressed. I'm going to wash my hands. Okay, so I took your vital signs. We did your height and weight, and your weight was 161 pounds. Your height is 70 and a quarter inches, which makes your BMI 23, which is in range for a normal weight. So it looks like you're eating okay. I'm happy with your weight. Do you drink enough fluids?
Yeah.
Okay. And before we begin the physical assessment, can you tell me your name and date of birth?
Devin Hero Cruz, August 10th, 1997.
Okay. And do you know what year it is?
2013.
And what building are we in?
Cape Coral Hospital.
Okay. And who's the President of the United States?
Barack Obama.
Okay. So first we're going to look at your skin. I'm going to look you over from head to toe and just make sure that there aren't any problems. Your skin looks even and uniform, tan in color. You don't have any rashes, no itchy areas, no lesions, any suspicious moles? No? Let me look at your scalp. Your hair looks clean and dry. You don't have any abnormalities, no dandruff. You have some rash on your face. Is that acne?
Yeah.
And what do you use for your acne?
Rapid.
And does that work for you?
Yeah.
Okay. I'm going to look at your back. And your skin looks even, no rashes. Your legs, your feet. They look good. And your nails. You have good capillary refill. It's less than 3 seconds. You have no clubbing, no cyanosis. They look good. And your toes also. Perfect. Okay, now we're going to do a neurological assessment. Your mental status, you are aware of where you are, so it looks like you're oriented to the date and time and place. I'm going to test your cranial nerves. I'm going to get a light and look in your eyes. Make sure your pupils are reactive. If you can just look straight ahead, don't look at me. I'm going to shine a light in your eye for a second. Perfect. Your pupils are equal. They're reactive to light. They're round. They're two. And they're brisk. And if you can smile for me, your mouth is symmetric. It opens evenly on both sides. Can you raise your eyebrows? Stick out your tongue straight at me. Stick out your tongue to the left and to the right. And can you shrug your shoulders? Perfect. I'm going to assess your deep tendon reflexes in your legs. Just let your legs hang and relax. Perfect. Good. Can you put your hand out and touch your finger to your nose? And the same thing with the other side. Perfect. Okay, I'm going to have you stand up and we're going to do some range of motion exercises. Can you roll your arms backwards and roll your arms forward? And move your wrists in circles and squint your hands. Get your head down. Roll it to the left and all the way around. Back, to the right, and down. Can you bend over towards me at your waist? Good. Can you bend over backwards? And to the left side, and to the right side. And you can raise one knee up. Perfect. And raise the other knee up. Okay. And if you can bend down as low as you can go touching your toes, check your back. Symmetric in a straight line, no scoliosis. That's good. You can have a seat back up on the table. Can you squeeze my hands? Good. Good strength. Push my hands up. Good. Push my hands down. Perfect. Try to push out on my hand. Good. Try to push out on my hand with this leg. Okay. So your eyes, do you have any problems with your vision? Can you see okay?
Yeah, I use contacts.
You use contact lenses and glasses, and you see the eye doctor regularly? Okay. Are you able to see all colors?
Yeah.
Okay. And your nose, do you have any drainage, bloody noses, nose problems with allergies or sinuses? Okay. I'm going to feel your sinus, so you tell me if you feel any pressure. Does that hurt?
No.
Does this hurt? No? Okay. In your mouth, can I see your teeth? And your tongue? I'm going to shine a light in and look at your tonsils. You don't have any tonsils? Did you have a tonsillectomy?
Yeah, I got it removed when I was younger.
Okay. You were having a lot of infections?
Sore throat.
Sore throats? Okay. And you see the dentist once every 6 months?
Yes.
Okay. And your ears, do you ever have any drainage from your ears? Okay. And you clean them regularly? You know not to put Q-tips inside your ears. You could puncture your eardrum?
Yeah.
Okay. Just going to look at them. And no problems hearing?
No.
Okay. I'm going to whisper a word in your ear and you tell me what word I said, okay?
Blue.
Blue?
Pink.
Pink. Good. So you have no problems hearing. And your neck is symmetric. Do you ever have tenderness here? These are your lymph glands here. No, they feel okay. Any problems swallowing? Okay. Your trachea is midline. It's not deviated. When you swallow, you feel like the food goes down, no problem? Okay. I'm going to listen to your heart. Your heart beats regular and even, no murmurs, no extra heart sounds. Do you ever have any dizziness or chest pain when you exercise?
No.
Any history of sudden death in your family from cardiovascular disease? Your pulses are 3+. And your pedal pulses are 2+. And before we began, I took your blood pressure in your left arm and your right arm, and they were both normal. 116/79 and 120/82. There was no difference, very minimal, in your left compared to your right arm. So I'm going to listen to your lungs. Do you ever have trouble breathing? No asthma? No cough? Okay. Just breathe normally. And take a deep breath. And another deep breath. Perfect. In your chest size, you have a 1:2 AP ratio. You have a good size of your chest being wide as compared to it as being long. I am going to listen to your carotid arteries. Make sure you don't have any extra sounds there. Perfect. Okay, I'm going to move this out of the way and I'm going to have you lay down with your head here and your feet there, and I'm going to listen to your abdomen. First I'm going to listen and then I'm going to feel, okay? I'm listening to all 4 quadrants, and you have vowel sounds, normal, active, and all 4 quadrants. And now I'm just going to percuss your abdomen so I can feel your organs. Do you have any tenderness in your abdomen or pain?
No.
The sound turns from resonance to dull over your liver, which notes to me that it's a normal liver. I'm going to put some light pressure and feel your abdomen. Feel your liver there. Do you use the restroom regularly?
Yeah.
No problems with bowel movements or urinating?
No.
No constipation?
No.
Okay, everything feels good. You can sit up. The last part of our exam is I wanted to go over a testicular exam. Do you perform those at home? No. Okay. You should do that regularly, once a month. Better to do it when your body is warm, so in the shower or right after a shower. You can feel your testicles and make sure that there's no changes and no abnormalities. What you want to do is you want to feel one testicle at a time, so you can do left and then right. You can roll your testicle in between your fingers and feel for any small lumps or bumps or abnormal changes. One side might be slightly larger than the other side, and that's completely normal. Besides feeling your actual testicle and rolling it between your fingers, you can feel your sperm cord. If you move up a little bit towards your body, you can feel the cord go up, and also that should not have any lumps or bumps or have any tenderness or pain when you feel it very gently. If you do develop any discharge from your penis, if you develop any lumps, bumps, increased size in one side or both sides of your testicles, or any problems or pain, you need to notify your doctor right away. Okay? I have printed out an article for you that tells you how to perform a testicular exam. You can take that home and review it, and then reference it in case you forget the steps to do it. Okay? I thank you for taking the time with me today to do a head-to-toe assessment.